The term psychosis describes conditions when a person experiences a loss of contact with reality and has difficulty understanding what is real and what is not real. Symptoms of psychosis include hallucinations and delusions. Hallucinations are false sensory perceptions not associated with real external stimuli and can include any of the five senses: seeing, hearing, feeling, tasting, or smelling. For example, individuals may experience hallucinations of seeing someone in the room when no one is there, hearing voices when alone, or smelling something cooking when nothing is being prepared. Some people are aware that their hallucinations are not real, while others cannot separate their hallucinations from reality. Delusions are fixed, false beliefs held by a person, even though there is concrete evidence they are not true. Examples of delusions may include believing that spies can hear your thoughts, people are poisoning your food, or a celebrity is in love with you. Symptoms of a psychotic episode include delusions, hallucinations, incoherent speech, and purposeless, excessive movement. Psychosis is a symptom of several mental illnesses, including schizophrenia, bipolar disorder, severe depression, or severe anxiety, but there are also potential medical causes. Sleep deprivation, medical conditions like hyperglycemia, side effects of certain prescription medications, and use of alcohol or other drugs can cause psychotic symptoms. Psychosis caused by medical conditions or substance use is referred to as delirium. It starts suddenly and can cause hallucinations, but it is reversible by treating the cause of the delirium. Nursing assistants can help manage patients' symptoms of psychosis with the following interventions: making sure the room is quiet and well lit, having clocks and calendars within view, inviting family members to spend time in the room, ensuring hearing aids and glasses are worn, promoting undisrupted sleep when possible, getting patients up and out of bed when possible. Schizophrenia is a type of mental illness with symptoms of psychosis that last for at least 6 months. In addition to symptoms of psychosis, it also affects how a person feels, with reduced motivation, difficulty concentrating, disinterest or lack of enjoyment in daily activities, social withdrawal, difficulty showing emotion, and difficulty functioning in daily life activities. It is typically diagnosed in the late teen years to early 30s. Depression is a common illness worldwide affecting an estimated 5% of adults. Depression is different from mood fluctuations or short-lived emotional responses to everyday life stressors or events, such as the loss of a loved one or the end of a relationship. Depression can become so severe that it affects the individual's ability to function at work, at school, and in their family roles. It can cause self-neglect, such as the failure to meet one's hygiene needs or obtain sufficient nutritional intake. At its worst, depression can lead to suicide. During a depressive episode, the person experiences a depressed mood, feeling sad, irritable, or empty, or a loss of pleasure or interest in activities they normally enjoy. Other symptoms may include poor concentration, feelings of excessive guilt or low self-worth, hopelessness about the future, thoughts about dying or suicide, disrupted sleep, changes in appetite or weight, and feeling fatigued. Bipolar disorders include shifts in mood from abnormal highs, called manic episodes, to abnormal lows, i.e., depressive episodes. These shifts cause significant impairment in the person's functioning socially or at work. A manic episode is an elevated or irritable mood with abnormally increased energy that lasts at least 1 week. As the manic episode worsens, the individual may become psychotic with hallucinations. During a manic episode, the person often experiences a reduced need to sleep or eat and can exhibit risky behaviors like excessive buying sprees, unrestrained gambling, or sexual indiscretions. Depressive episodes have opposite symptoms of manic episodes and are exhibited by low energy, low motivation, and loss of interest in daily activities.